Okay. Magandang hapon po sa inyong lahat. Good morning, good afternoon, good evening everyone. Nasaan man po kayo sa parte ng mundo. Welcome to the 70th installment, number 70 of the Stop COVID Deaths webinar series. And thank you for being part of another milestone webinar for our credible online community. For all of those who have just discovered us for the very first time today, welcome po, at sa ating mga masusugid na avid viewers, maraming salamat po sa inyong suporta. With the National Capital Region under the pilot implementation of the alert level system for the COVID-19 response, we are now going to take a look outside of the National Capital Region to find out what is going on in their areas. The places with the highest numbers of cases are Quezon City, Cavite, Laguna, Manila, and Bulacan. It is expected that efforts to control the spread of the virus have focused on these places. However, recent news reports point to increasing numbers of cases, high positivity rates, congested hospitals in the provinces. So ano po ba ang sitwasyon sa ating mga probinsya? Ano po ba ang kanilang mga challenges pagdating po sa pagbabakuna, sa testing, contact tracing, treatment, at pangangalaga ng mga pasyente? Ano po ba ang kanilang mga ginawang sort of innovations? Paano po matugunan ang mga challenges na ito? And how are our frontliners, very important question, coping, lalo na po dun po sa nasa probinsya po. And if you want to get the latest updates from our credible sources, then you are in the right place. I'm Dr. Raymond Francis Sarmiento po from the National Telehealth Center of the National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date, and I always look forward to Fridays because I get to share hosting duties with my partner in crime and my mentor, also our adjunct research faculty from the National Telehealth Center, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyo lahat. Saan man kayo naroon, we hope you're doing well. We know the situation is very challenging, Raymond, no? Very challenging situation for our frontliners, but I can see we have our regular viewers from all over the country, from the Northern Philippines, from the Visayas, and I want to greet all of those who are watching us from Mindanao and from different parts of the world. 70th, Raymond, I don't believe it. This is the 70th webinar that we've done. And, we are here. Kami po ay nandito dahil nandyan kayo. Kung hindi po sa inyo, hindi po namin magagawa itong webinar na to. So we just want to thank everyone for staying with us. It's important for us to hear what's happening on the ground. And, we also want to know if you have watch parties. Kasi we heard that in some hospitals, a group are listening at the same time. So if you are, can you put that in the chat if you have a watch party? Even if dalawa lang kayo, watch party rin yun. So just put it in the chat if you've got a watch party, because we want to know who we're reaching, how we're reaching you. And of course, if you have suggestions how we can do better, we're most welcome to your suggestions. So we have a very important topic, as Raymond has said. Dumadami yung mga kaso sa mga probinsya, and you're going to hear from some very, what should I say, some very important and very committed frontliners from different provinces who are facing many challenges now that we're seeing greater spread in the provinces and in the rural areas. So stay with us. We are certainly looking forward to new things to learn and to a good discussion later. So Raymond, over to you.
Thank you, Dr. Susie. So for those who are wondering po, no, talagang marami po talagang clamor and call to augment our health system's capacity, decongest our hospitals, ensure strong triage and referral systems, and to essentially put our discussion in context. Let's watch this very short video by TVUP, ang ating person on the street interview.
Kaso ng COVID-19 sa probinsya ng Calbayog City. Sa ngayon naman is hindi siya lumalala kagaya ng ibang lugar. Average siguro may mga 12 hanggang 15 araw-araw na kaso.
Hindi naman masyadong lumalala. So parang na-control na nila yung situation sa aming specifically sa city ng Catbalogan.
Sa lugar po namin ay dumadami po yung case ng COVID.
Sa ngayon, dito po sa Los Baños, yun, lumalaki po yung porsyento ng pagtaas ng COVID.
Kasi marami namang sinaswab ng mga cases, pero yung nagpa-positive ay isa, dalawa, minsan wala. So sa tingin ko, na-control na nila yung situation, mataas yung tracking at saka yung contact tracing.
Lalo na kapag halimbawa may mga pumapasok na sasakyan tapos Tagalog yung nagsasalita. So talagang tinatanong nila kung saan ang galing, tsaka kung anong gagawin or kung dadaan lang or hindi. Kapag sabihin na mag-i-stay sa city, talagang dinadala sila diretso doon sa isolation facility ng city.
Sa obserbasyon ko naman po, kaya po umakit po yung pag-antas po ng COVID dahil po sa mga tao po sa amin matitigas po yung ulo po. Lumalabas po na wala pong kailangan.
Wala po akong masyadong idea kung ilang percent na po ang nababakunahan. Pero nakita ko naman tuloy-tuloy naman yung vaccination na ginagawa.
Kami mismo na mga staff, mga ka-opisina ko sa plan at saka yung family members namin ay nabakunahan na. So sa tingin ko naman ay mataas yung commitment ng aming LGU sa vaccination program. So actually kahit nga hindi taga sa amin, halimbawa yung mga ka-opisina ko na nasa Manila nagre-reside pero dito sila naka-assign ngayon sa Catalogan, nakaka-accept din sila. So binibigyan sila ng pagkakataon na mabakuna. So sa tingin ko, okay naman yung vaccination program ng aming syudad.
Sa ngayon po ay hindi pa po ako vaccinated. Sa ngayon po, naka-register pa lang po ako ngayon sa akin pong pagbabaksinan po. Sa lugar naman po namin, halos po marami na po. 50% po na vaksinan na po.
Hanggang A4, no, tinatanggap na nila ngayon. Like A1, A2, A3 hanggang A4. Mayroong ganun na serbisyo sa COVID vaccine sa city ng Calbayog.
Ito na yung ito na yung better, tawag ko nga better normal. Ito na yung normal. So nano-normalize na siya sa communities namin. Sa city namin specifically, makikita mo talaga na okay na yung mga tao, naka-recover na siya. Marami ng tao sa park, marami ng tao sa kalsada. At nag-abide naman sila sa protocols ng aming munisipyo at ng aming syudad specifically. So may naka-mask pa rin, nag-face shield pa rin, at nandoon pa rin yung QR codes na strictly ini-implement. Sa tingin ko sa amin, medyo okay na siya kasi nakakapag-conduct na rin kami ng activities sa aming organization. So,
sana tulungan natin yung isa't isa kasi yung katawan natin talaga yung asset na maganda na meron tayo. Mag-ingat lagi. Tulungan yung nasa sektor na lumalaban ng COVID, tsaka sumunod sa kung ano yung makakabuti naman sa bawat isa.
It's always nice to hear what's happening on the ground. And I mentioned earlier the watch parties, no? So thank you first TVUP for that great interview. Mga kababayan natin nasa iba-ibang mga lugar, and we'd like to see more of your faces. I mentioned the watch parties earlier. If you send photos of your group who are in a watch party on Facebook, we're going to show them here on the webinar. Audience participation daw yun, no, di ba? So we just want to have more, we want to see more of you. So if you have a watch party or if you have a group photo that you want to share, put it on Facebook and we are going to acknowledge it on the webinar. So Raymond, over to you.
Thank you, Dr. Susie. So para po sa ating mga nanonood, lalo na po sa ating mga social media accounts for TVUP, UP, and Stop COVID Deaths, maraming salamat po. And you could participate po sa ating Zoom poll or ating fun poll by going to www.menti.com at entering ang ating code. Ano po ba ang code natin today? There we go. The code is 6225-0629. That is 6225-0629. So if you are, let's say, outside of the Zoom, you can still participate in our fun poll and we will be flashing the fun quiz in a little bit. For those who are asking, para naman po sa ating certificates of attendance, those will be given to those who have watched at least 50% of the webinar duration po. Meron po ba tayong, there we go, okay. So, yan po ang itsura na essentially of what you will be receiving as an electronic certificate. We are continuing to answer po requests, especially for those who have not received any certificate na feeling po nila ay dapat po naka-receive sila for the last 69 webinars that we have had. So please contact us at stopcoviddeaths@up.edu.ph so we'd be able to answer each and every one of your questions po. For those who are attending naman po for the very first time, for today, the structure of our webinar will be as follows. We will have a set of speakers and then a set of reactions po, and then we'll have the Q&A session. We will be entertaining questions not just from the Zoom but also coming in from the YouTube channel where we are being live streamed sa TVUP po and also sa ating Facebook. Okay, so without further ado, I'll turn the floor over to Dr. Susie.
Yeah, thank you very much, Raymond. I think the participation, and we have some nice questions for you. Ibang klase naman yung fun questions natin today are kind of fun. So we'll wait for that. But today we're gonna have a roundtable discussion, and I know there's still a lot of misinformation out there, particularly in relation to what's happening outside of Metro Manila. So today you're going to hear it firsthand from some leading frontliners from different provinces. We're going to open our webinar with some words from the Chancellor of the University of the Philippines in Diliman, who is in fact a mathematician, and is joining us today, Dr. Fidel R. Nemenzo. Chancey Fidel, welcome to the webinar.
Hi, good morning. Good morning, Doc Susie, Doc Raymond.
Hi, Chancey. Where are you now? Parang...
Nandito ako ngayon sa PGH. No? I'm battling COVID. I'm confined here. Okay naman ako at dahil bakunado na ako, at tingin ko mild lang ang aking mga symptoms. No? Konting lagnat, ubo, sakit ng ulo, pero nananatiling okay ang aking mga oxygen level.
Okay,
UP doctors and nurses are taking care of me.
Good to hear, sir.
That's good to hear, Chancey. And good to see you, even if you have COVID, that you're able to join us, which just shows us that for the great majority.
My pleasure.
Yeah, you're able to do it. Okay, so please go ahead with your introductory remarks. Go ahead, please.
Good afternoon, everyone. I'd like to thank Doc Raymond and Chancellor Padilla for inviting me to give today's opening remarks. No? Alam niyo, these are not ideal circumstances, but there's a reason to be thankful that we are all here. While the cases of COVID continue to rise every day, we have an opportunity today to share experiences of responding to the pandemic. Webinars such as this not only document our struggle, but also become a ground for harnessing and sharpening what we have learned from that struggle. This is a chance to show that our university is resilient and can confront the challenges before us. Alam nyo, my terms as Chancellor started in March 2020, and I was given a most unusual welcome by the pandemic. One of my first decisions was to form the UP Diliman COVID-19 Task Force. In response to the public health emergency, our task force is composed of faculty, staff, students, and health workers who come from different perspectives, who lend their expertise to provide multidimensional perspectives to the pandemic, which is a complex and fast-moving problem. And given the uniqueness of UP Diliman as a community, malaki po to. We count not only our students, faculty, and staff, but also a population of about 56,000 residents from within and surrounding the campus. No? So it's become more obvious to us that the university does not exist outside the larger community. Whatever happens in the community affects us. Whatever happens on campus also impacts the communities around us. Like the rest of our country, we have had little preparation and have had to learn along the way. Early on, we realized that ours should be a community-based response to the pandemic. For UP Diliman, this response entailed the following. Now, one, understanding and monitoring the emerging needs of UP constituents as the pandemic unfolded. Two, tapping the various expertise available in our university community. And three, capacitating the university on pandemic response, no, through self-learning, collaboration, and piloting. So ang response po namin sa pandemic was diverse, it was widespread, and integrated. It was developed over time and took many months and months of discussion to consolidate. No? Ang aming task force po mula noong March 2020 ay nag-meet, without fail every Wednesday. And we have mobilized and committed the resources of our university to mount and sustain our work. Aside from creating a task force, we have also set up monitoring teams and designated health liaison officers in all units. Alam niyo sa UP Diliman, there are 27 colleges and many non-degree granting centers. There are over 100 buildings charged with implementing and monitoring health protocols and pandemic response activities. No? We also make sure that we comply with guidelines of DOH and IITF. Using the public health framework of test, trace, and isolate, we conducted a targeted testing of personnel who perform high and very high risk functions. No? This was followed by a mass testing of all our personnel during a surge. No? All this was based on risk assessments of the different university units. Ang contact tracing po namin na ginagawa ng aming public health unit, supported by a pool of volunteer contact tracers from our residential communities. To quarantine and isolate the sick, we have converted 3 buildings. The biggest building, Palma Hall, kilala ng marami as the AS building, our Molavi dorm and Kamya dorm, we have converted this into isolation facilities. Since April 2021, UP Diliman, in partnership with the Quezon City government, has also been operating a vaccination site at our College of Human Kinetics Gymnasium, no, to help in the overall effort to protect citizens of the city against COVID-19. To date, our vaccination site, we call it Bakunahan sa Diliman, has vaccinated about 15,000 Quezon City barangay residents and UP personnel and constituents. From these initiatives, we have demonstrated the value of collaboration and partnership with LGUs, non-government organizations, community groups, and individual volunteers. Our Kamya dorm isolation facility, for example, is being run in collaboration with the Quezon City government and the Philippine Red Cross. Our Bakunahan sa Diliman is not only a partnership with Quezon City, but is fully run by medical and community volunteers. No? For this, we have mobilized more than 400 volunteers. No? Likewise, we should also mention the contribution of workers' unions, vendors' associations, and other community-based groups in these efforts. In following the approach of testing, isolating, and contact tracing, UP Diliman has demonstrated the effectiveness of the public health response identified by local and national governments, as well as international agencies such as the WHO. Moreover, we have been able to test the critical value of our community engagement in public health crisis. No? The work of our volunteers has sought to mitigate the impact of the pandemic on the more vulnerable members of our community, such as our ambulant vendors, our jeepney drivers, the informal settlers, contributing to the efforts to provide social protection to poor households. In addition, our community information and education campaigns assist in local and national public health information campaigns. With the biggest surge we've seen so far, a big challenge for us is how to present evidence-based information about COVID health and the pandemic. The public could better understand and, more importantly, relate to their everyday lives. The research that we're doing is important. In fact, UP Diliman will soon be participating in a collaborative research with UP Manila to study vaccine effectiveness using data from our vaccination site. We hope that this research will shed light on how vaccines work in our context and given the vulnerabilities of our communities. This collaboration is in addition to ongoing collaboration between UP Manila doctors and researchers with UP Diliman engineers to develop affordable technologies to help combat the pandemic. So more than ever, the university's role as a patient and sympathetic teacher and educator is needed. Sa panahong ito na may pandemya ng COVID-19, kasabay din nito ang pandemya ng misinformation. Kaya mahalaga ang papel ng UP sa pagpapaliwanag ng mga bagong kaalaman tungkol sa pandemya. Pero kailangan natin ipakita na ang agham ay makakatulong sa tao. Ibig sabihin, malaking hamon po sa ating mga doktor, mga scientist na isalin ang lengguwahe ng agham sa lengguwaheng malapit sa nakakarami. Clearly, our new context requires us to explore new ways of doing things. This webinar series is one way of reaching out to the public by sharing information and insights from our collective experience of the pandemic. Yun lang po, maraming salamat sa lahat. Maraming salamat sa paglahok sa webinar na ito.
Okay, thank you very much. That is our Chancellor, VP Diliman, Chancellor Fidel Nemenzo, and thank you for your words. Thank you for joining us despite the fact that you're in the hospital. And Chancey Fidel, look in the chat box. That's why we really love this online community. We are a community, this group. Everybody's wishing you well. Everyone's hoping that you get well soon. It's a very caring community, and so find some comfort in the chat box. So we will have you in the panel later, and hope that this doesn't tire you so much. Thank you so much for joining us from the Philippine General Hospital. All right, over to you, Raymond.
Okay, thank you so much, Dr. Susie and Chancellor Fidel. Sir, take short breaks lang po, no? And we hope you'll be able to still join us during the Q&A panel. Okay, so for this webinar po, no, we will be choosing upvoted questions for a chance to ask your question live to our panel by opening your camera and essentially opening your audio and being able to address each of our panelists po. So we encourage everyone to start typing in your questions now in the Q&A box ng ating Zoom or in the comment section ng ating mga Facebook pages or in the YouTube channel. Before we proceed, may we ask everyone to participate in our fun quiz. It's been flashed dito po sa Zoom, sa Menti. Eto na po iyon. We have 2 questions right now. Medyo na-miss po namin ni Dr.
Raymond, parang ang question natin ngayon, geography, ano?
Oo nga po eh. Tsaka medyo nakakamiss Dr. Susie yung mga icon natin last week. Pero anyway, the first question reads, what is the population of Sulu? Does anyone know the population po of Sulu? Fun quiz lang po, no? So kahit hindi na po kayo mag-Google, so para lang po masagutan ng ating fun quiz. Options are option A, 340,000, option B, 500,000, option C, 1 million, option D, 1.5 million, and option E, 2 million. Okay, so habang pumapasok po ang inyong mga kasagutan, let me take this opportunity to greet those who are joining us from Radyo Pilipinas Dagupan in Bonuan, Geset, Dagupan, the Provincial Health Office in Nueva Ecija, in Kaanawan, the Dupax District Hospital in Dupax del Norte, Nueva Vizcaya, Philippine Association of Medical Technologies in Talisay, Cebu, and Gregorio Luch, I hope I'm pronouncing that correctly, Memorial Hospital in Iligan City, Lanao del Norte, also who have registered internationally from the Chonin Hospital in Taipei, Taiwan, Nguyen Thai Hoc Clinic in Canto, Vietnam, Penang, Malaysia, Oman College of Health Sciences in Muscat, Oman, University of Hail, Saudi Arabia, Dubai, United Arab Emirates, Lunichi Ali University of Blida 2, Algeria, University of Fiji, Lautoka, and the UP International Nursing and Healthcare Forum from Lexington, Virginia. Maraming salamat po. For our second question, ito naman po, population naman po ng Queen City of the South, Cebu City po. Would you know? Without googling po, without googling. Option A, 340,000. Option B, 500,000. Option C, 1 million. Option D, 1.5 million. Option E, 2 million. So we hope you'd be able to continue to participate po. No? We'll leave our Zoom poll and our Mentimeter open as we continue on with our program. Our speakers will comment dun po sa correct answers during the panel discussion.
Raymond,
Okay. Yes.
some are answering in the chat box. Teach them how to go to the poll.
Okay po. So if you are going to the poll,
Polling.
there's it's being flashed on the screen. If you're in Zoom po, no, at least you should be able to see what is labeled as pre-webinar questions. Dito naman po sa Mentimeter, you'll have to open your internet browser, go to www.menti.com and then enter po ang ating code which is flash on the screen, 62250629. That's 62250629. So,
Raymond, if they're on the Zoom, tingnan nyo dun sa baba ng screen nyo, merong nakalagay participants chat, share screen, tapos polling. I-click nyo yon, may lalabas na questions. Yun.
yes po. So you should be able to see it. Baka medyo mahirap lang po pag nasa phone, no? Pero we hope you'll be able to
Oo nga pala, no?
enter your answers. Okay. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. So we go to the meat of our topic today, and as you know, we have been talking about what's happening in the provinces. And lately, there have been reports of really surges in the provinces. Napupuno ang mga ospital, wala ng oxygen, pumipilang mga ambulansya, nauubusan ng kama. Marami tayong naririnig. Okay, now we will be talking about that, but we will also be talking about what are the innovations, what are the things that we are doing well. So we're going to celebrate also the good things that are happening despite this. Nagtutulong-tulungan itong mga hospital na to. And this is part of really our community of, wanting to solve the problems. So wherever we are, we try to do what we can. And I think as you get to know each other more, it becomes easier to network, share information, and you will love our speakers today. So for our first speaker, okay, I am very honored to introduce to you somebody who I know, who I would say is one of the best, if not the best, field epidemiologist in the country today. Not many people know it, but I saw him go through the ranks, was a star in the field epidemiology training program of the Department of Health when he was much younger. And currently, I'm so happy that he is the regional director of the Department of Health, a difficult region, Region 2, the Cagayan Valley Center for Health Development. Let's welcome Dr. Rio Magpantay. Rio, welcome to the webinar.
Maraming salamat po, Ma'am Susie. It's good to see you and it's good to hear from you. It's been a long time. Salamat po sa mga papuri. Parang nanliliit po ako dito, maliit na nga lalo pang nanliliit. Maraming salamat.
Rio, you deserve much more. I'm always delighted to have you guys who I know are working very quietly behind the scenes. Sometimes maraming banat sa Department of Health, but if only people knew about the work that people like Rio Magpantay do, then, I think it would be different. So Rio, we would love to hear from you. Ang balita ko, and when we had our little conversation, sabi mo nga, maraming mga kaso, no? So what's your situation in Region 2? Please go ahead with your presentation, Rio.
Maraming salamat po at magandang hapon po sa ating lahat. Again, Doc Susie, Doc Raymond, at sa lahat po ng ating mga audience, ang katerba, nakikita po natin na nakatune in sa atin. Isa pong napakagandang umaga. Mainit po rito. Sana sa inyong lugar mainit din. At ang ating pong panonood ay painitin pa rin po natin dahil napakaganda po ng ating mga topics ngayon. Kami po ay nagpapasalamat dahil kami po ay naimbita para maipakita po naman namin ang sitwasyon dito sa Region 2. Alam niyo naman, halos NCR lang ang lagi pong nabibigyan ng attention in terms of news. Pero we would like to everyone to know what's happening in our region.
Rio, teka sandali, I'm gonna interrupt. Can whoever's manipulating your slides put it on slideshow? Kasi what we're seeing the ano eh. Pwede ba siyang i-slideshow? Yun, yung parang presentation.
Yes, ma'am. Hold on.
Sandali.
Is okay?
Hindi
Not
pa
yet.
eh. We're still seeing it's not yet on presentation mode. Lapit na, yan na.
That one, Director Rio. Yung pong parang baso sa baba, sir. Yung kanina.
Yung mukhang ano.
Yan, that one, sir.
Yeah,
Can you
it's
click?
not functioning. I don't know why.
Try again,
So,
Rio.
hindi po ito mag-subtract sa aking oras po, ha?
Ikaw pa? No way. Rio, you take your time. You're
Okay,
covering so many
we'll
provinces.
just check.
Yeah, there you go.
There we go.
Perfect na,
Yeah, there we
perfect
go.
na. Oh, go na,
Okay,
Rio.
ma'am.
Okay yan.
As
Go.
I was saying, maraming salamat po. And this time I'll be discussing the situation of our beloved Cagayan Valley and how it stood the test of time of this pandemic. Araw-araw po is a challenge and it has become a daily learning experience for everyone. Lalo-lalo na po sa mga health workers dito sa aming rehiyon. We have learned to capacitate each one's strength and have worked in partnership with everyone, including the community involved in the fight. Cagayan Valley is composed of 5 provinces po with 3.6 million. And it's located in the northeastern section of the Luzon Island. Baka hindi pa po kasi alam at may quiz kayo kung saan nakalagay itong Cagayan Valley. It's composed of Batanes, Cagayan, Isabela, Nueva Vizcaya, and Quirino. I'd like to discuss to you ilan na ho ba ang naging kaso namin dito sa rehiyon. As of yesterday, meron na po tayong confirmed cases na 88,679. At nadagdag nga po kahapon, ang highest namin since we started doing the surveillance, 1,324 cases for a day with 2,676 deaths. Medyo mataas po ang ating case fatality rate of 3.01. And nakakagulat din po ang positivity rate namin which is at 32.8%. Record high po siya dito po sa aming rehiyon. This slide will show the epidemic curve in our region from January 2021 up to the present. It is noteworthy that our areas with outbreak are our 4 centers of trade, namely Santiago City, Tuguegarao City, Cagayan City, and Iligan City. Makikita rin po natin dito sa ating timeline that the peak of cases were seen to have followed the detection of the local variants of concern. First in March, with the detection of the Beta and the Alpha variant, and followed in the month of July with the detection of the first case of the Delta variant. If we talk about the epidemic risk classification of the entire region, it falls under high risk. Santiago City, which is an independent city located in Region 2, also falls under critical risk. The province of Isabela, Nueva Vizcaya, and Quirino remains at high-risk classification, including Batanes, which is now flagged as high risk due to the detection of 3 new cases of COVID. We also would like to say that recently, siya po ay naapektuhan ng bagyo at kasalukuyang nagre-recover po ngayon. Cagayan province is at moderate risk. The healthcare utilization rate is at 85.98%, while ICU utilization rate is at 88.83%. Going to critical na po kami. To date, meron na po tayong 122 recorded Delta cases in the region. All provinces have recorded cases except for Batanes. Overall po, the entire region is at alert level 4. Maganda po ang partisipasyon ng ating government hospitals as well as private hospitals. Based doon po sa itinalaga natin na dapat po meron silang at least 50% bed na i-allocate po sa COVID for government and 30% for private. You could see in this slide that it surpassed for the government the number of beds at 50.43%, and it surpassed 15% of ICU beds with 21.72%. COVID mortality trend shows that deaths peak in the month of August, though it is seen in the graph that it has already started to increase in April when local variants of concern have been detected. Sa ngayon po, medyo dumadami talaga po ang namamatay. It's very, very, very sad to hear and see that there are still cases dying, particularly even in level 3, of course, and our private hospitals, which are level 2 hospitals. For the information of everyone, there are only 3 level 3 hospitals in the region, and these are all DOH retained hospitals. One in Cagayan Province, the Cagayan Valley Medical Center, one in Isabela, which is the Southern Isabela Medical Center, and one in Nueva Vizcaya, the Region 2 Trauma and Medical Center. Testing capacity of Region 2 has increased and is now at 4,442 per day with 5 molecular laboratories in the region. This is attributable to the Trace, Test, and Treat, or the T3 program, which targets to ramp up the testing capacity. However, there are testing challenges, namely, number 1, GIDA areas have difficulty or even have no access to RT-PCR laboratories. There's limited RT-PCR testing kits and rapid antigen test kits. There's also shortage of laboratory staff due to them being infected with COVID-19, leading to longer turnaround time. Again, it's very sad to say na there's a lot of healthcare workers now being positive, and of course, if their colleagues are close contacts, nauubusan na rin po ng health workers dito po sa ating rehiyon na mag-duty po sa ating mga hospital. This is the greatest challenge that I am facing right now. And the last among the testing challenges, number 4, is that dadawa lang po ang probinsya na meron kaming molecular lab, which is Cagayan and Isabela. And the other provinces, Batanes, Quirino, Nueva Vizcaya, have yet to put up at least a single or just one molecular laboratory. Tingnan naman po natin ang ating vaccine statistics. In line with our prevent, detect, isolate, treat, and the integrate plus strategy, yung plus po yung vaccination. Vaccine statistics show that our vaccination coverage is at 16.54% of our target population, which is 2.585 million. This is 70% of the population. And we think that is still very, very low. With the breakdown of coverage, we could see that among the frontline healthcare workers, senior citizens, persons with comorbidities, essential sectors, indigent population, and priority group B and C, as shown on this bottom part of the slide. Senior citizens having the most number of fully vaccinated individuals at 204,745. This is the latest data as of yesterday. Now, let me have some innovations. Let me discuss some innovations for vaccination, which include the flying vaccination teams. These are composed of our own staff from the regional office, assisting in areas with very low coverage, mostly hard to reach areas. We also have the Res Vacuna on Wheels, initiated again by the Department of Health Regional Office number 2. Pinartner po namin siya doon sa Philippine Red Cross Vacuna Bus to reach geographically isolated and disadvantaged areas, or the GIDA areas. And promising, marami po talaga ang pumupunta dahil gusto na po nila talagang magpabakuna. Ang mahalaga lang sana madagdagan pa po ang bakuna ng aming rehiyon at madagdagan pa rin po ang aming vaccination teams, considering there's a lot of healthcare workers nga po na nagpo-positibo. For a more appealing and easy to remember facts on vaccination, nag-launch po kami ng Res Vacuna jingle, which was composed by our own staff, and a TikTok challenge was also done for all the local government units who wish to join. Some LGUs also have set up Res Vacuna Pantry, giving ayuda to those who have been vaccinated and those who wish to be vaccinated, and provided transportation assistance to vaccinees going to vaccination sites. Social media posting on best practices on vaccination was done to encourage local government units to do the same or to do better in vaccination. Innovations and extraordinary measures taken at the regional, provincial, and municipal level on the PDIPR strategies include the following. On prevention, number one. In the past months, local transmission has been seen in workplaces with poor administrative and engineering protocol. And in order to address this, an initiative of our own region's regional task force and interagency task force is the creation of a sub-task group on workplace management, composed of several agencies, to name a few: the Office of Civil Defense, of course, the Department of Health, Department of Trade and Industry, Department of Labor and Employment, and the Civil Service Commission. This monitors implementation of minimum public health standards in workplace settings. Empowering national government agencies, GOCCs, and private institutions, and even state universities to have their own COVID response teams called COVID-Worth, which stands for Workplace Response Teams for Health, has greatly helped decrease workplace transmission by early detection and isolation of cases. To add, we also have initiated the COVID Wars, meaning workplace alert system, which notifies the COVID response teams of symptomatic or close contact employees. The establishment of Communication Bureau, which includes local government units, national government agencies, information officers, media, and other stakeholders, which aims to inform and educate the community at the ground level by focusing on IEC campaigns that are translated to our very own dialects, was also established. That's for the prevention. Now let me go to for the detect strategy. These are the innovations. We created our own COVID-19 information system in Region 2, tagged as COVID CODA, which enables all disease reporting units access real-time data, including release of RT-PCR results. We have also established the collaborating centers for disease prevention and control, again in our own office, which is composed of the Cagayan Valley Epidemiology Center, its training component, diagnostics and laboratory center, also located in our regional office, and the Disaster Risk Reduction for Health Center. These centers are responsible for the coordinated COVID-19 response approach. In addition, we launched the conduct of the Applied Epidemiology Training Program and Data Management and Analytics Training to equip our epidemiology and surveillance units, both at the regional, provincial, and local levels, other local levels, to conduct prompt and efficient surveillance and epidemiology investigations. This is actually a 9-month program, modular, and this ensures ACT, which stands for Accurate, Complete, and Timely Data. And lastly, we have organized a regional contact training team specific for variants of concern, composed of interagency personnel, in order to strengthen and improve the efficiency of contact tracing of VOCs or variants of concern. For the treatment strategy, as an initiative, the one line, or offering non-stop health services and empowered linkages in nation's emergencies and disasters, was established at the regional level, provincial level, in order to hasten the referral process and avoid delay in patient care. We also have the mental health network services, which includes the following components: the Ugnayan, this is the Regional Mental Health Council during COVID-19 pandemic; the Unawa, the application of MHGAP strategy in COVID-19 management; the MITSA, the supporting health facilities and LGU mental networking program initiatives; and of course, our networking for all the mental health and psychosocial support training for NGAs. Now, let me discuss the LGU innovations on prevent strategies. The different medium for IEC materials used include the use of bandillo, social media platform, regular radio airing, and local TV programs, among others. For the detect strategy, the LGU's use of the academe-developed contact tracing applications such as HealthGuard was utilized. Iligan City, which is a city in Isabela, established its own COVID-19 molecular laboratory. Other LGU innovations, we strengthened partnership with volunteer doctors in the region for patients on quarantine to conduct telemedicine and teleconsultations. Mental health services provided in the communities such as quarantine therapy for Batanes, e-Kumustahan for Nueva Vizcaya, and the adoption of Project Gabay in all provinces. LGUs recognize the importance of mental health as part of COVID-19 response. As an ending slide, the COVID-19 pandemic has really shaken heavily every one of us. It became a global health crisis that has affected how we see the world and how we get to spend our daily lives. But as they say, we should never lose hope as to what the future may bring. The most important thing now is how we get up together to win this battle. Maraming salamat po, and I am sure we will recover as one. Mabalo, which is thank you in Ibana.
Okay, thank you very much. That's Dr. Rio Magpantay. My goodness, Rio, what an excellent presentation. Very clear, very logical. We can see how you're thinking. You think through all the different aspects of the pandemic. And I was really so happy that you accepted the invitation to speak, because I think a lot of people don't know this, but really the success of the Department of Health is with the regional directors. And as you can see, even if there are limitations, really, I'm a little shocked you only have, what's it, 2 molecular labs. Oh my goodness, for 2.5 million people. Kulang talaga ng suporta, no? Pero ang ganda ng presentation, I think. And guys, you can all see, no, na Rio presents you with numbers. That's why I told you he's the best field epidemiologist in the Department of Health in the Philippines. Sige, thanks Rio. We hope you'll join us later for the
Yes,
for
I
the
will po. Maraming salamat po again.
thanks Rio. Okay, so we'll go to Raymond now. Raymond.
Thank you, Director Magpantay. Excellent presentation, sir. For our next speaker in our roundtable, he is trained in internal medicine and subspecialty in infectious diseases from the Philippine General Hospital and graduated Doctor of Medicine from UP. He's a medical specialist too at Vicente Sotto Memorial Medical Center and faculty at Cebu Doctors University College of Medicine, as well as research coordinator for Chonghua Hospital in Mandaue, consultant for Cebu City Emergency Operations Center and Project Balikbuhay, as well as infection control chair and infectious disease practitioner in various hospitals in Cebu. Let's welcome to the webinar Dr. Bryan Albert Lim. Bri?
Yes, a very good morning, everyone. I just share my slides. Okay, so maraming salamat po. Thank you for the invitation. It's truly an honor to be able to be given this opportunity to share our hard lessons in Cebu City. No, I think in the course of this pandemic, we make mistakes along the way, but I think it's all right, because as long as we learn from those mistakes and we keep on moving forward. Now, so before I start, I would just like a few disclaimers. So the views presented are my own. No? I do not represent the various institutions that I am affiliated with. So COVID response is dynamic. No? So kahit na gumaganda yung situation namin ngayon, hindi po talaga guarantee ito na ganito na kami forever. So it's very important to acknowledge that. And I do not carry the monopoly of viewpoints, so differences are most welcome. And I really would like to acknowledge Dr. Magpantay. It's truly an honor listening to him as well. I am not affiliated with any political party. I keep on saying this because people have asked me so many times, since I work with both sides. No, in the course of this pandemic, there's only one side that matters, and that's the side of saving lives. No? So my perspective, as Dr. Sarmiento has mentioned, this is what I would like to bring to the table. So I'm a clinician, so I take care of COVID patients in both public and private hospitals. So I was there in the forefront in transforming some of the hospitals here in Cebu in preparing for COVID, no? So from the very start, wala talagang ospital na handa eh. Alam naman natin before the pandemic yung mga isolation rooms natin maliliit lang, no? But of course, we have to make do with what we have. And of course, I'm a consultant of different LGUs, no? I think it's important to help and to guide our leaders in the best way we can, and manage and help set up a number of temporary treatment and monitoring facilities here in Cebu. And currently, I'm working with the Project Balik Buhay. It's a consortium. It's an alliance of different chambers of commerce here in Cebu to better balance health and economy. So I would like to. I apologize if this is not the right political term, no, surge or spike. Forgive me, I'm not an epidemiologist, but I would just like to show you our journey from last year up to now. And as you can really see, there are 3 surges that Cebu has encountered. The surge last year was the most painful, no, professionally and personally. No, I lost my dad last August, to COVID-19, and I almost lost my mother. No, so it was truly a very tumultuous situation. During the time, ang dami pa naming walang alam, and I'm sure the rest of the country, the rest of the world were studying on how to learn and how to adapt to this new virus. We were put on ECQ last year twice. And of course, we did not waste that time, and we set up a number of innovations which I shall share with you. And some of these really echo the efforts of our colleagues in different parts of the country. And however, we thought na okay na kami. So we had a very good Christmas, nakapagbakasyon ako kahit papano. And then come February, March, April, nagkaroon kami ng second surge. But I will tell you here, no, what happened here, tumaas ito kasi I have to admit, we let our guards down, especially even in our staff, kasi akala mo okay na eh. So we, some of the contact tracers, hindi na tinuloy ang contract ng DILG, etc. And then medyo lumobo. But I will tell you what, no? Share a few slides later on comparing the first and second surge and the impact of creating all of these health system reforms, no? In saving, of course, the most important thing is being able to save the most number of lives. And here we are now. What happened was we are now in our third surge, Delta-driven surge, no, here in Cebu. And as you can see, but I am glad, no, because very up na ngayon, medyo kumonti na talaga ang mga kaso namin. Masaya ako sa regional namin, dati punong-puno, ngayon po 52% na lang po yung occupancy kasi bumababa na po talaga ang kaso. And as you can see here, we learned also so many lessons during this third surge, which I will share with you. So allow me to be candid. No? That's why may disclaimer tayo. Kasi of course dito kapag we are sharing our lessons, dapat the entire story should be said. So we learn from both our mistakes and our successes. No? So if I may, during the first and second surge, here in Cebu, we monitor, no, apart from the DOH bed tracker, we monitor the actual capacity. No? So may dalawang arms po yan. The private sector monitors it, and then the private sector also monitors. And allow me to share, ito lang, no, kasi alam naman natin na mas marami po talaga ang private hospitals kaysa sa public. So allow me to share the data. During the first surge, in the private hospitals, we reached up to 86.3 capacity utilization. But during the second surge, kahit na mas marami yung cases namin, our hospitals were not overwhelmed during the second surge. No? And this is the reason why. The glaring statistic is really mortality. In our first surge, our mortality was very glaring. No? One of the highest in the country kami dati. I think our case fatality rate noon, umabot kami ng 6.6%. But during our third surge, highest namin was 1.1%. No? So, ano talaga, makikita mo yung difference, and I would be sharing with you how I think, on my personal opinion, we were able to achieve this. But of course, the story changed when Delta arrived. Talaga itong Delta nakakairita. No? So parang, ano talaga, we were caught off guard, and I shall share with you those lessons as well. Ito po yung sitwasyon namin sa Cebu, and I'm sure I resonate this with the rest of my colleagues, no, na talaga yung health system natin, hindi po talaga tayo handa sa pandemic. No? So implementation of national policies were unclear, nag-iba-iba per LGU. It's as if COVID changes as it crosses borders. No, the LGUs were still adjusting its organization structure. Alam na po natin yan. sa ating mga City Health Department, yung communicable disease division, maliit lang po yan. They handle all the different infectious diseases. But ito na sa COVID, iba na parang biglaan, nag-iba na lahat. So it took a while. The evolution made coordination and collaboration a huge challenge. Iba-iba po ang mga boss natin, no? Sa district, sa provincial, sa DOH rating, sa private, iba-iba po ang mga boss. And alam po natin, kahit dati pa, in terms of all this integrated referral system, it barely existed, no? And gaps in the understanding of the science, no? Napakarami pong hindi pa naintindihan yung infectiousness, yung wala kang symptoms, pwede kang makakahawa, the science of testing, etc. It took a while, but of course, repeated engagement is so important to make leaders, to enlighten leaders and the masses as well. And the differing political affiliations, the mistrust, there was a lot of noise, and the challenges in communicating policies to the masses were very difficult. However, we were able to pull through. I have to say, it's really a triumvirate of the national agencies, the LGUs, and the private sector. I would like to dwell a little bit about this, no? The national agencies, nung medyo nag-insecure kami, nagpadala sila ng very key people. I have to mention their names. They're the only 2 people I will mention, no? 3 people I will mention kasi ito talaga for me are the cornerstone in the game changer in the way we manage COVID. General Feliciano and his wife, Mia Feliciano, was sent by the national government to help us. And for me, it was a blessing to have a third-party person coming to Cebu kasi during that time, kailangan namin na someone neutral para we needed people that people can trust, no? And the blessing there, the wife of General Feliciano, Mia Feliciano, is a nurse. And for me, sobrang win po nito kasi siya po yung taga-bulong kan General kapag merong hindi masyadong clear. And they became really the voice of multiple sectors. It was really a blessing na they came from outside, no? And the Office of the Presidential Assistant to Visayas was also very, very helpful. And the good thing there was synergy. In the local government units, during that time we were thinking na siguro dapat doktor ang mag-head ng Emergency Operations Center, but I'm glad na hindi, no? Kasi when you talk about implementation, for me hindi the best yung doktor to lead in terms of community response. Kasi mahalaga po na ang nagli-lead niyan ay may alam sa politiko, may alam how things are implemented, and who can preempt when things can go wrong. Here in Cebu, it was in the person of Councillor Garganera, and I really support him and recommended him to the group, to the regional IATF kasi he was a barangay captain for several years, no? And he really knew how it is to implement all of these things in the ground. Kasi as we always say here in Cebu, kung hindi alam ng kapitan, hindi alam ng mga tao in the ground yung community response natin, hindi talaga matatapos itong pandemic. Napakahalaga po talaga ng community response. And of course, I would like to mention the synergy with the private sector. The private sector, I'm very happy. I'm part of Project Balik Buhay, and even early on last year, we would meet on a daily basis, no, because we wanted to update, no. Dapat, I think the key here in the pandemic is dapat meron talagang collaboration, may clarity, may synergy, and the important thing is to be able to bridge these gaps. So I would just like to share a few innovations of this collaboration as a testament to this synergy, no. Ito po yung pwedeng join namin sa Cebu City, no. I mean, alam naman natin sa Cebu, may Cebu City, may Metro Cebu, may Provincial Cebu. Iba-iba po yon, iba-iba po ang mga leaders. I shall focus on Cebu City because that's where my work really is. But of course, I shall touch on some innovations in Metro Cebu and Cebu Province. Ito po yung nakita talaga namin, napakaganda po yung mga policies natin on the national level. But the lacking there is how to translate that on a step-by-step cookbook type of manual, no? Na tipong contact tracing team, ilan ba ang kailangan? Ano ba ang mga qualities na dapat kunin? May makukuha ng data, anong data ba ang dapat kukunin? Paano ba siya dapat ina-analyze? And how will it change policy, no? So I'm proud of this manual that has been a product of multiple authors, no, from the police, from the barangay captains, and from policymakers, from doctors, etc. So we established the Emergency Operations Center, and it has been adopted in multiple cities. So there's clear algorithms, of course, the algorithms recommended by PSMID, unified protocols which cuts across LGUs. Most, of course, have been followed, but of course, there are certain modifications. Centralized data, so it's very important. Our Emergency Operations Center will acquires all of this data on a daily basis. So I'm very proud. No? Every morning, they would meet every day, 8 to 10 p.m. to analyze the cases, to analyze the contact tracing cases, para yung game plan nila and strategy nila for the day are evidence-based, data-driven. So very important po yung real-time information. So pati po yung crematoriums, yung funeral homes, yung ambulance, yung police, ilang healthcare worker ang na-COVID, ilang actual bed capacity, hindi lang po yung bed na binibilang, yung talagang kaya ng ospital, namomonitor po natin yan. And of course, the good thing there is we design and implement data-driven, culturally sensitive policies. No? So example, kapag nakita natin na dumadami yung COVID natin sa industry na ito, so kinakausap po natin, hindi natin pinapahiya, pero kinakausap natin para pong matulungan para ma-prevent ang future outbreaks. So contact tracing, karamihan po ginagawa siya sa gabi para po hindi mapahiya ang ating mga kababayan. Dito din po ginagawa namin yung chismis, no, na kapag may naka-quarantine sa bahay, kinakausap natin yung mga nasa barangay. Ang galing po ng mga kapitan, meron po silang mga tao, pakitingin naman at pakisumbong kung tataka sila. It's quite effective. So talagang napakarami pong innovations, no, itong mga kapitan natin. No? Love na love po namin itong mga kapitan namin kasi talagang in the forefront of the pandemic na doon po sila. And another product of this synergy is Bayanihan Cebu. So as you can see, there's the national government, there's the Department of Health. There's also the different, even church groups are here, no? Kasi dati, wala pang temporary treatment and monitoring facility, yung hindi pa po nauso yung mga isolation center. Gumawa na po kami sa Cebu, ginawa namin noon modified isolation center po siya. Ibig sabihin, ina-admit po namin dito ang mga moderate cases para hindi po pumunta sa ospital. Now, para po how do we ensure that they would follow and they would not bypass the referral system, may incentive po. If they follow this system, the triage system, kapag mo-progress po sila to severe, may assured bed po sila sa tertiary. So may ganun po kaming mga MOA sa mga tertiary hospital. If anyone progresses, aalagaan po, ipa-prioritize. And I am very proud, no, kasi I come from UP also. The UP Medical Alumni Society, no, of Cebu has been in the forefront of all of this. So reassuring po, imagine sa isolation center na ito, may OB-GYN, may endocrinologist, may pulmonologist, may infectious disease, may orthopedic surgeon pa nga . So paano po talaga na holistic at ma-assure natin ng ating kababayan na hindi po sila papawalang bahala sa treatment facility na ito. No? At ang mga dapo nito, kapag they follow this mechanism, meron din po silang ayuda. No? May grocery po sa bahay kapag na-admit sila dito sa itong facility. No? So para lang po, hindi mo-overwhelm yung ating mga hospital. And another product, if I may, with this synergy is, as I mentioned, Project Balik Buhay, which is a consortium of different chambers of commerce. The private sector really stepped in our vaccination program. I'm very proud of this initiative. No, the various church groups, universities, hospitals, and of course, no, my dear UPMAS, no, is also a partner. So ginagawa nito, yung vaccination namin, yung paghakot, mechanism sa pag-recruit at paghakot is per industry. So may choice po, kapag Cebuano ka, pwede po kayong magpa-register sa LGU nyo, or if you are working in a company or in an industry, even in SMEs, pwede po via the company ang pag-register. Ang maganda nito, yung na-observe namin, nagkakaroon ng parang pockets of, hindi naman herd immunity, no, but pockets of sort of herd immunity in these industries. Imagine, if lahat ng empleyado, isang bagsakan po yung sa isang factory, bumaba po talaga yung nako-COVID sa industry na iyon. So I'm very proud of this, no? Talagang tumutulong po. At ang maganda nito, kahit example, nakatira ka sa Cebu City, but you're working in Mandawi City, if you are vaccinated in any of the Project Balik Buhay sites, regardless of where you come from, you will be catered to. So may convenience po siya. So I'm very happy, no, na may ganitong initiative sa amin. And ito pong latest initiative ng Project Balik Buhay, no? Kasi with all the morale is low, especially sa search, napakadaming problema. At ating mga nurses, Diyos ko, kawawa talaga, no? May maraming issues sa benefits, etc. I'm very proud, no, that the private sector stepped in, no? So nabibigay po ang private sector ng additional 15,000 per month per frontliner working in the COVID wing, no? So this will not solve really the issue of low wages, no, but I think this is a good example of solidarity, and I think in this pandemic we have to encourage those acts of kindness. So again, doon naman po tayo sa health service delivery. Napakahalaga po nito, no? Dati talagang yung primary care hindi po talaga norm kasi dumidiretso sa mga specialists. Devolution talagang napakahirap po talaga. Down referrals not well accepted. Patients bypass primary and secondary hospitals, and contact tracing was a challenge. So ano po yung mga ginawa namin dito sa Cebu? Dito talaga, no? So daily trackings, of course, there's the DOH bed tracker, but we also track the actual bed capacity, no? And daily tracking of the proportion of patients according to severity. Kasi for example, ang ospital nito maraming mild or maraming moderate, talagang tinitriage na po namin papalipat sa ibang district or sa mga TTMF. And daily tracking of inventories, no? So every day po, all the hospitals, their supplies are being monitored. So alam po namin kung anong ospital ang wala ng oxygen, walang high flow, etc. So resources can be allocated accordingly. The next strategy is coordination. We have weekly meetings with the DOH retained and provincial hospitals. Napakahalaga po talaga itong mga huddle na ito. Lumalabas yung mga issues at natutugunan po natin. Daily endorsement and mentorship. So nagka-problema kami dito nung nag-third wave kami. Dumami po kasi yung cases sa Cebu province and in the provincial area. So of course, bagong problema ito kasi dati kasi napaka-infectious. So ginawa po natin yung the Philippine College of Physicians, meron po tayong partnership with the provincial hospitals na yung IDS, infectious disease at pulmo, mini-mentor po natin yung mga colleagues natin sa provincial hospitals via telemedicine. So I'm very proud to say, sa Oslo District Hospital, napakalayong kung saan yung mga whale sharks sa Cebu, nakaka-manage po tayo ng mga severe doon at marami pong nabuhay na. No? May isa nga kaming 70% yung auto saturation, but na-manage po ng Oslo District Hospital at nabuhay po yung pasyente. So vs the Sotto, no, I'm very proud of our DRS Regional Hospital. Our IM graduates kasi required po kasi yung return of service, and they chose to serve in the provincial hospital. So they became our leaders there. They become our coordinators kasi na-train na po natin yan, no, sa regional. Magaling na mga batang yun. So weekly analysis of logistical and inventory issues, importante po yun. Na hindi lang po puro reklamo rather than ano ba ang specific problem at ano yung pwedeng solution na pwedeng magawa. And of course, weekly meetings with our vaccination partners. Napakahalaga po nito. Proud of this, Vicente Sotto, our dear medical director, Dr. Gerardo Aquino, had the foresight. Inayos na po namin, meron pong oxygen production plant ang Cebu. So the oxygen plant namin can produce up to 800 tanks a day. So hindi po kami ever nag-shortage sa oxygen. During the third surge, maraming gusto mag-hoard, and we have to reassure them, huwag kayong matakot. May oxygen production plant tayo sa regional on top of the private distributors. So we can easily cater to around 2,000 oxygen tanks a day. So when we reassure the public, nawala po yung hoarding. Na-minimize po yung hoarding. And I'm also very happy, no, when the third wave happened, support in the province was also given by the provincial government. They bought 40 high-flow nasal cannulas and several MECVent. The regional hospital, we also have 100 mechanical ventilators, no, and of course, I think 70 high-flow nasal cannula already. So talagang it's a numbers game. The pandemic is a war on logistics. Logistics po talaga. But of course, sinisumab naman ang issue ngayon. But hopefully now the cases are going down. Kaya hindi talaga pwede magka-fourth surge kasi wala pang tocilizumab, napakahirap makakuha. And malapit na po kung matapos, no? Capacitating the health service delivery triage, ito po yung sinasabi natin. Yung public schools, ginagawa nating barangay isolation centers for the mild and asymptomatic. And TTMF po yung mga modified TTMF, temporary treatment and monitoring facilities. And some of the hotels have already been leveled up, no? Na mga hotels, may mga doktor at nurses and even laboratory na rin po. Kasi para hindi po ma-overwhelm ang ating hospitals. Nagka-problema kami sa Cebu sa third surge kasi meron kami 3 mega TTMF that was able to cater to 500 people for moderate cases. Sinara po namin ito kasi we transformed that into vaccination mega centers. Kasi of course, akala namin na okay na, but then Delta happened. So now the future direction of Cebu is to have a permanent fixture na talagang i-maintain yan para for future surges and pandemics. So, so Cebu, we have 8 testing sites, testing laboratories. We can test around to 7,000 RT-PCR tests a day. But I think the most important thing here is meron po kaming mga free swab testing sa different cities. Mandaue has, Lapu-Lapu has, even the province has. But for me, the most extensive is Cebu City kasi ito yung pinakamalaki. We have cluster clinics. Punta ka lang doon, isa-swab ka. And we even place the picture here is in Quitos. It's a mountain barangay because the challenge of transportation, etc. At dumadami din po yung cases sa mountain barangays. So we place a cluster clinic there para naman doon na sila magpa-swab if they have symptoms. So I think testing is so important. It has to be accessible. So even our Sotto, our beloved regional hospital, may drive-through din po. And most of the private hospitals may drive-through din PCR testing. Information, talaga alam na po natin yan. Data is scattered, coordination is difficult. So really, for me, the turning point in Cebu, it's really the real-time data collection. So talaga in the morning, from 8 to 10 a.m., grabe po yung nakokollect na data. Na naka-ready na po kasi yan, naka-Excel na yan lahat, tapos automatic na po yung graph, para copy and paste na lang yung staff. So mabilis po siya. So we can create evidence-based, data-driven policies on a real time, And for example, si kapitan na ito, dumadami ang sa barangay niya, kinakausap natin at natutugunan. And at human resource, ito po yung problema na nauubusan kami ng nurses, and I'm sure we are all having this problem. So of course, DOH has augmented the staff, pero minsan kulang talaga, wala na po kami ma-hire na nurses. So ngayon, we have analyzed na gumawa kami ng time and motion study on the work of the nurses, and as you can really see, 40 to 50% of the work of nurses is not really related to nursing. A lot of those is coding the laboratory, coordinating with the patient's relatives. So ngayon, we are now hiring nurse assistants, at para yung trabaho ng nurse talaga is just patient care. Hindi na po niya dapat inaasikaso yung mga tawag-tawag na yan para po ma-maximize natin ang ating mga health human resources. And of course, now we have telegabay, na-inspire po kami sa PGH. Maraming salamat po. Pero yung gabay namin, yung bay ng Cebuano na bay, and our students are also helping, in terms of medical students, and our doctors are also helping in this telemedicine consultation and home management. But I think the good thing about this platform is nakalink po siya sa referral system. So kung yung tinatawagan na ng telegabay, nag-avail nun ay mag-progress, ready na po yung ospital para po ma-accommodate itong nag-follow ng health ng referral system. Importante po talaga ma-incentivize natin Kung sumunod ka sa proper protocol, dapat priority ka. Parang ganun. So don't worry, you followed us, you followed the process. If you progress, we'll take care of you. So may ganun po tayo. Ito po yung 3 little pigs na napaka-cute po ng picture na to. Talagang, I like this because this represents the 3 surges. We learn lessons along the way, and I think I'm very positive about this. It's really long-term resiliency requires adaptive learning. Kaya hindi ako masyadong judgmental, Parang kung may nagkakamali, hindi tayo dapat masyadong very galit. Of course, tayo, but the key here is to acknowledge the mistake and move forward. And I think I love that in the Cebuano spirit, of resiliency. Humility and sincerity are the cornerstones for meaningful collaboration. Mahalaga po talaga na we swallow our pride more often than not, Kasi may point po talaga ang mga sectors natin. Health system is beyond the DOH. Hindi po talaga kaya ng DOH lang ito. It requires private sector engagement. It requires guidance from academia. It requires police, security, economic transformation, etc. We are all interdependent, and the health system needs to radically evolve. So what's the next steps for Cebu? This is my last slide. we're setting up a multi-sectoral resiliency plan. So hindi na po kami papayag. We have to minimize the impact of the surge. We plan to democratize testing. So we're still planning different models on how this is to be done. And use of policies, our counselors are already creating policies in the use of open spaces. And in this Monday, we have invited Dr. Dance, Tony, and Ma'am Inday, the use of CO2 detection as a proxy in assessing a well-ventilated space. So may mga ganun po tayong innovations, capacitating hospitals and streamlining referral systems. I see this personally as growing pains of universal healthcare. Now more than ever, our mayors and our provincial government is now more than aware and really on board in planning the long-term development of our healthcare system. And of course, vaccinate, vaccinate, vaccinate. And we intend to have closer collaboration with the business sector. And I'm glad that our chambers of commerce are on board and they have helped us a lot during this pandemic. And of course, educating consumers and the masses. Gumagawa kami ng app na parang travel advisor na yung mga establishment na nagfa-follow ng minimum health standards, makikita mo. So you know where to eat na safe, no? So we plan, no, yung mga communicators namin dito, we plan to create a brand that if you go to a facility wherein the employees are vaccinated, may tatak, safe ka. Sa Mandawi, ginagawa na nila yan. May safety seal. If merong open space, proper yung pag-divide, may HEPA filter, may malaking ventilation, may CO2 detection, may special seal ang Mandawi City na ito safe tayo dito when we dine in this space. So I think very important because in the new norm, infection control is the new brand. No? Thank you.
Oh my goodness, thank you so much. Napakahusay, my goodness. Bryan Lim, Dr. Bryan Albert Lim of Cebu Doctors University Hospital. Such a passionate presentation and really so great to hear all these innovations in Cebu, no? From the free testing to the additional funds that are given to the nurses on the front line. This is amazing, amazing. So I think, Bryan, di mo alam na alam ko to, no? Bryan is a clinical epidemiologist as well.
Hindi po, infectious disease po ako, ma'am.
Infectious disease, pero nag-clinical epidemiology ka, di ba?
Ay, nag-development economics po ako, ma'am, sa School of Econ. Thesis po, hindi ko po natapos dahil nag-pandemic.
Okay, so your mentor, Dr. Noel Huban, was just texting me and saying you're really great from the very beginning, ang husay-husay. And I think our audience can see, how impassioned you are and how this spirit that you bring, no, is really what we need. Kasi, parang we cannot stop with our limitations. We have to move forward. We have to keep on moving on, and that's what I see in your eyes when you're speaking. So thank you very much, Bryan. We're going to our next speaker. All right. So from Iligan City, and Iligan City is a little bit close to my heart. I guess you guys remember Sendong when there was like 7 to 10 meters of water that hit Cagayan de Oro and Iligan City. And I was part of a team that tried to help out there. And I was asking one of my classmates who's a cardiologist in Iligan City, Miriam Timonera. Sabi ko, sino bang pwedeng magsalita dyan? Kasi mukhang maraming kaso ang Northern Mindanao, no? Ang Cagayan de Oro, Iligan City. And she gave me one name. She said, you have to talk to Dr. Leonell Albert Quitos or Kits. And we are very, very privileged to have Kits with us. He's internal medicine, adult infectious disease fellow, also trained at the Philippine General Hospital. He is in Iligan City, Lanao del Norte. Kits, over to you.
Yan.
No po. Thank you very much po. Thank you for this opportunity to speak. No, this is my first time to speak with this large audience. So I'll just share my screen.
Yeah, go ahead, Kits.
Dr. Susie, I think Dr. Kits is the only, please correct me if I'm wrong, Kits, infectious disease specialist in Northern Mindanao, tama ba?
Hindi po, in Iligan City po.
Iligan City, okay.
Unfortunately, ako po yung mag-isa.
Oo, talaga. This is the one. He's the one, Raymond. He's the one. Who knows?
Okay, take it away, Kits.
Sipo. So I am Dr. Leonell Albert L. Quitos. I'm an adult infectious disease specialist practicing here in Iligan City. And I'm going to give you a picture of the Iligan situation. No, so it's like this slide, no, a blank slate, because I think we're still in square one. So unfortunately, I'm here, no, not speaking on behalf of the Iligan local government unit nor the regional DOH. I'm not even speaking on behalf of the local IATF because I'm not part of it. No, I'm not part of the making of the protocols. I'm also not speaking on behalf of the medical society, although we have already given a lot of recommendations, no, to the local IATF. So I think my role here is to express my opinion of the Iligan situation as a healthcare worker, as a frontliner, and as a private clinician. So I think I'm just going to express my frustrations, no, that I think I share with a lot of my colleagues, with I think, no, with not just in our locality but with other LGUs also. So to orient everyone, Iligan City is one of the cities in northern Mindanao. It is around 90 kilometers away from Cagayan de Oro City, which is the more popular city in our region. So as you can see, it is part of Lanao del Norte, but it is a lone district, so we are independently administered. It is surrounded by Lanao del Sur, by Misamis Oriental, parts of Bukidnon, also, you know, with Marawi City, and we are catering to a lot of patients. No, I have catered to patients coming from Zamboanga, coming from Cotabato, Bukidnon. So Iligan City caters to all these neighboring places. It is known as the city of waterfalls. No, so if you can visit here post-pandemic, then you can really appreciate the waterfalls. And it is one of the gateways to northern Mindanao. I think this is one of the problems also, since it is one of the gateways, you cannot control the movement of the people. We have a population of 372,770 as of the local statistics last 2020. And last year, we detected, no, I handled the very first COVID-19 confirmed case in Mindanao, who was PH40, and he was transferred to the Northern Mindanao Medical Center in Cagayan de Oro, where he expired. I think he was also one of the first fatalities outside of NCR. And last year, Iligan City was a bit popular because we were the only city which underwent the most strict quarantine classification by that time, no? And then that was around a year ago. So kumusta naman kami this year? This year we are still at a high risk, no? With a average daily attack rate of 10.9%, 2-week growth rate of 26.19%. So the DOH Region 10 classified our city as a high-risk area. So this is where it gets bloody. No, around September 14, around mga 3 days ago, we hit our first 1,000 mark for the total active cases. And then most of them are in isolation facilities, but many, a good number, are admitted. And in here, no, I'm very sad to say that Iligan City has, I think Iligan City has the highest death rate of around 7.36%. No, and it is way higher compared to the regional death rate, compared to the national and the global death rate. So we're really doing, we are really in a mess here in Iligan City. And look at our bed occupancy. As of yesterday, we have a 94.11% occupancy in our COVID beds. No, and if you would like to look at the highlighted red figures, no, you can see here that our hospitals are catering more than the bed capacities that they have allocated. So maybe you're asking also, Doc, where are the other patients? You said 100 plus lang yung admitted sa inyo. So where are the others? No, actually, I don't know kung saan yung iba. But what I know is some are in Amay Pakpak Medical Center. Amay Pakpak Medical Center is located in Marawi City in Lanao del Sur, and it is a DOH retained hospital. No, what's good with Amay Pakpak Medical Center is that they have a training program for IM and the other specialties. They are more equipped and they have more bed capacities. I think they can cater to around 200 COVID confirmed cases. So last September 7, Iligan City residents from Iligan City was able to occupy 39% of the COVID beds in Amay Pakpak Medical Center. I think shortly thereafter, their medical chief posted a memo wherein they want to close their doors to non-Marawi, non-Lanao del Sur residents because they want to cater to their own. And I really understand. So also Marawi City is around 40 minutes away from Iligan City. So many of the patients would prefer to be admitted there because they know they have better care, they have more medicines, more equipments, and they have seen in social media posts how good the patients were taken care of. So going back to our beloved city in Iligan, GTLMH is this is the Gregorio T. Luce Memorial Hospital. This is our local government hospital here in Iligan City. Last September 14, we had a total of 45 confirmed cases, and with those admitted cases, only one was fully vaccinated, and 3 were partially vaccinated, and majority were unvaccinated. And it is we must take note also that of the patients who were in severe or critical COVID-19, those were the partially and the unvaccinated. And regarding September 14 was a very sad day for us because we had 7 mortalities in 24 hours. So we looked at them, we looked at their vaccination status, and all of the 7 mortalities were really unvaccinated. And we looked at their status, they were in the A3, A4, A2, A3 priorities of the COVID-19 vaccination. So it's very sad that they were not able to get their jabs. And during that time also, we ran out of tanks, as in literally ran out of tanks, 0. So those patients who were under high flow nasal cannula were removed from the machine, and they were unhooked, and they were placed in regular O2, from mga 15 liters lang yung mga NRMs natin. And then 2 were also mechanically ventilated by that time. And then sadly, they really succumbed to the effects of hypoxia. I'm showing you here how under-equipped Iligan City is. Remember that we have around 370,000 residents here in Iligan City, but we only have 6 functional mechanical ventilators, and we have only 12 functional high-flow nasal cannula. So how can we cater to a lot of these people with just this scarcity of equipments? And in Iligan City, sadly, we have a lot of home deaths because some of them were not catered in hospitals. Some of them refused to go to hospitals because of the fear of to be labeled as COVID-19, and then just preferred to die at home. So going back to our death rate, our 7.36%. Now that's very high, and I think what really contributed to this high death rate is the under-testing in our locality. So the global death rate is just 2%. So we really need to step up our testing here in our city. So this is our testing center. This is our molecular laboratory located in GTLMH. The setup was started last December 2020, but unfortunately, up to this day, 9 months later, no, it is still not operational. Does not have an LTO. So I cannot comment further on what really happened. But this is really sad for us because it's there, and we just need to comply the necessary requirements, no. So siguro if this is up and running, maybe we can step up our testing, and then we can test early, and so that we can treat early, so that the outcome would be better for these patients. And I really agree with Dr. Bryan and with Dr. Magpantay on their statements where testing is really vital here. Testing capacity. So I asked the institution here in charge of the testing capacity, and I asked them regarding the positivity rate. I asked them on the number of samples taken, and this is what they gave me. Now they gave me nothing. They gave me a blank template. Wala. So I cannot say anything on the testing capacity, no, because this is really reflective of how poor our testing is here in our city. So let's go to one of the also sad aspects here in our city. It is the low vaccination coverage. No? If you would look at this data, this was last around August 31. Region 10 had 14.12% no vaccination coverage, and then leading ang Cagayan de Oro. But nangungulalat po ang Iligan City at around 11.78% lang. So I asked again the institution that is in charge with the vaccination here in our locality, and this is what they gave me. So as of September 13, if you look at the right side of the figure, parang medyo okay naman, no? A1, 100% coverage. Sa A2, nasa 52% tayo. And then sa A3, nasa 75%. So I think we're doing great, no? But no, we're not doing great because the denominator here is the master listed. No? So for example, our A2, our senior citizens, we have 40,000 senior citizens here in Iligan City, and only 25%, roughly above half, no, are master listed, and with only 52% coverage. So I'm saying here na baka we are only testing around 1/4 of our we are only vaccinating 1/4 of our senior citizens here, and then that's very unfortunate and scary because we know senior citizens naman are those who are really vulnerable to develop the severe disease and who are really likely to die. No, so by this time, around September 13, our vaccination coverage is around, again, no, mababa pa din, around 12.70% lang. So, pero ito naman, I have some good news naman, no? I was able to get some data from 3 institutions here, from 3 private hospitals, and sadly, medyo mababa yung vaccination coverage ng isa. And then, maraming nag-refuse dun sa kabila, no? And then, dito po, tingnan natin yung mga breakthrough infections among those who were fully vaccinated. And then, medyo alarming. For AMCI, around 24.7% had breakthrough infection. And some naman, dalawa, developed severe disease, no? But luckily, these 2 patients, these 2 healthcare workers were very responsive to our treatment. Nobody underwent hemoperfusion. Yung isa received tocilizumab, nag-high flow nasal cannula, and then nag-improve naman the following days. Yung isa naman is a doctor who developed severe disease, severe dyspnea, was very responsive to tocilizumab. No, after the first dose, nag-okay na siya. So luckily for Iligan City, no, nobody died, no, among the vaccinated healthcare workers. So in summary, Iligan City needs more COVID beds. We need more manpower. Siguro we need a Bryan Lim here. We need a Dr. Magpantay. A lot of them, we need them here. We need life-saving equipments. And Iligan City needs its own testing center. Again, testing is very important in our COVID-19 response. So when we test early, we would treat them early, and then we will have a better outcome for them. And then Iligan City needs to step up on the vaccination rollout. And then, this is the good side. In my talk, that vaccines really save the lives of our healthcare workers here in Iligan City. So that's all. Thank you very much.
Okay, thank you very much. Another very good presentation from Dr. Quitos, who is an infectious disease specialist in Iligan City, and really highlighting so many issues, problems with testing, vaccination, low coverage. No, thank you, Kits, for a very candid presentation, because I think, and I like the point where you were talking about the denominators, that it looks like there's high vaccination because it's the master list. That's not the way that that's not the way that you compute. That's not the denominator that you use, for these things. So I think it's very important that you've brought out some of these very, very challenging issues from your perspective, and really very happy to have you here on the webinar. And I know you collected information from different sources, but thank you so much for that great presentation. Okay, over to you, Raymond. We have one more speaker.
Yes, one more speaker. Thank you, Dr. Kits, especially for that infographic on Iligan City. Very, very important just to compare it, how Iligan City performs in the situation there with regards to the other kapitbahay po niya mga probinsya. Okay, for our, I believe, our last but not the least speaker po for today, alam niyo na po kung sino yung sasagot ng isa sa mga katanungan sa ating Zoom poll kanina po. Yun din yung question sa ating Mentimeter. She will now be talking about the situation in Sulu province. Please welcome to the webinar Dr. Fahra Tan-Omar. Dr. Fahra? You're on mute, ma'am. Okay, there we go.
Okay. Good afternoon, everyone. Thank you for this opportunity to share and learn from all the speakers. So this is Sulu, an archipelago of more than 100 islands. It is one of the provinces in the Bangsamoro Autonomous Region in Muslim Mindanao, or the BARM. It is located in southwestern Mindanao. Sulu is home to almost 1 million Tausug, predominantly Muslims. It is a second-class province with 410 barangays in 19 municipalities. It is mainly agricultural. Poverty index is high at 75%. There are 10 hospitals. Majority are classified as infirmary and some as level 1. Total bed capacity is 425. Note that there are no private hospitals. As of yesterday, September 16, there are 695 confirmed cases, of which 21 are active. We had 24 deaths. This is the number of cases per month. Note the increase in October of last year, where most of the patients were health workers from the Sulu Sanitarium. There were spikes also in May and June of this year. 17 of the 19 municipalities have been affected, with the highest number in the capital town of Jolo, followed by the adjacent municipalities. RT-PCR testing is processed in Zamboanga City Medical Center or at a private hospital. We swab suspects admitted or seen at the OPD and send a specimen by commercial boat. Specimens processed at the DCMC are free of charge, but it takes 2 to 3 days before results are released. Testing in the private hospital costs 3,500 pesos, and we get the results after 24 hours. In April of this year, the Philippine Red Cross Holo chapter started collecting specimens, both saliva and swab. They are sent to PRD Zamboanga City, where results are released after 2 to 3 days. Cost of saliva test is 2,000 pesos and 3,500 pesos for the swab test. They have collected a total of 11,444 specimens over a period of 5 months. A negative RT-PCR test is required for entry to Zamboanga City. We pass Zamboanga if we go to Manila, Cebu, Cotabato, and elsewhere. This stringent policy of Zamboanga City has actually controlled the entry of possible spreaders to the province of Sulu. This is the Provincial Isolation Facility with 96 bed capacity from the Bayanihan Fund of the national government. Operation started in April 28 of this year. Prior to this construction, schools were used as ligtas COVID centers. This is the newly built RT-PCR laboratory in the compound of the Sulu Provincial Hospital, funded by the Ministry of Health, BARM. Groundwork for application for LTO is ongoing. We started vaccination in March of this year. We have received a total of 159,170 doses of vaccine, Sinovac, AstraZeneca, Janssen, and Sinopharm. We have fully vaccinated all the health workers, 15% of the senior citizens, and a significant number of adults with comorbidities. 55% of the vaccine supply have been given, and 12% of the total population are fully vaccinated. This is where we store our vaccines. Here are some pictures of the vaccination activities. Many areas are hard to reach. This is a Bajau senior citizen, the poorest of the poor. We are not devoted to the LGU as we are directly under the supervision of the Ministry of Health in BARM. Yet the LGUs from the provincial, municipal, and barangay levels have been very supportive. They provided the venue, usually a gym, including the tables, chairs, tarpaulins, alcohol, food and water for the health workers and volunteers, and security. There have been 28 breakthrough infections recorded. Majority are asymptomatic. Nobody required hospitalization. Now the challenges. Early in the pandemic, we did not even have test kits nor access to testing. We did not know how to properly collect and transport specimens. All of us doctors were cramming to update ourselves. Since the provincial hospital is only a level 1 facility, there is no provision for an ICU. COVID-19 is highly infectious that we cannot refer to higher centers in Zamboanga City as the LGU would not allow entry. We manage patients in our own areas, including in municipal and district hospitals. Initially, we did not have coveralls. We only had face masks and gloves. Because of the lockdown, we cannot buy. When finally we were able to access hazmat, it cost 1,700 pesos per piece. Wala pang washable noon. Oxygen tanks also come from Zamboanga City. Even if cargo boats were allowed, travel was limited to 2 to 3 times a week instead of daily. Then there is this refusal of relatives to bury suspects without the Muslim rites of washing and shrouding. The COVID scare significantly reduced consultations in rural health units, so immunization rates and antenatal care declined. There was poor follow-up of patients with chronic illnesses, including tuberculosis. Hospital admissions decreased. Even graveyard workers refused to bury suspects. Field health workers were overwhelmed with monitoring of PUI, later on of close contacts on home quarantine, and contact tracing. The contact tracers hired by MILG for 6 months were not really of help. This time of the vaccination, misinformation has caused refusal. People do not show up for dose 2. They have also become choosy for the single-dose vaccines. Sending of specimens to Zamboanga City have been tiring. How did we face the challenges? The Sulu Interagency Task Force was cohesive with the strong leadership and full support of the governor. He requested DOH-9 RESU staff to train our personnel on swabbing and handling of specimens. They were flown in by the AFP in a special flight. That was actually our recommendation, and local officials listened to us. Law enforcers helped in various ways. They manned the checkpoints, apprehended violators, even helped in burial of suspects. They also joined the monitoring team to check compliance to quarantine. The IATF in the municipal levels are responsive. The LGUs facilitated distribution of ayuda, including food assistance for frontliners. When we could not access suppliers, the governor purchased a plane load of PPE and supplies. They were transported from Manila to Jolo by the Philippine Air Force. We updated ourselves through social media. The ulama and other Muslim religious leaders helped in information campaign as they command a following in the community. This included teachings of Islam regarding burial without the rites. The Provincial Health Office regularly updated district and municipal hospitals and RHUs on protocols which were changing from time to time. Finally, despite the fear of exposure, RHU staff did door-to-door service delivery like immunization of children and senior citizens, antenatal care, and even insertions of subdermal implants. Some pictures. This is one of the many meetings of the Sulu Interagency Task Force. This is ayuda distribution in a municipality. Sako yung mga bigas, hindi kilo-kilo. And then he's a very grateful recipient. All frontliners, not just health workers, were given 1 sack of rice each 2 times during the lockdown. These are the PPE and medical supplies from the provincial government. This is bringing services to the homes amidst the pandemic. A senior citizen given PPV 23. We had to catch up with immunization. We often hear of opportunities and in adversities, you know, like the online selling of pastries and food, plants, home decors, and other businesses. The pandemic was also an opportunity for the province to showcase its natural resources, like the pristine beaches. To reduce boredom and stress from travel restrictions, the people started to explore Sulu, which became a lot more peaceful, that locals would even stay overnight in beaches without fear of being abducted. Poverty rate may be high by standard measures, but I think people here are more comfortable compared to those in cities like Metro Manila, because food is cheap, delicious, and of very high quality. This rock formation in another beach has also become a favorite during this time of the pandemic. Thank you for your kind attention. Assalamu alaikum.
Okay, thank you very much. Another very, very good presentation from Dr. Fahra Tan-Omar, the Chief of the Integrated Provincial Hospital of Sulu under the Ministry of Health of the Bangsamoro Autonomous Region of Muslim Mindanao. So for those who are not aware, they're not under the Department of Health. They have their own Ministry of Health. And as you can see, that they have had to do their own innovations. Nagsikap talaga sila, and you can also see the issues in relation to not having testing facility. Ngayon pa lang na itatayo ang testing facility nila. And of course, they're doing vaccinations, but really, Farah, thank you for joining us, for putting all those photographs together and giving us a picture of what is happening out there in Sulu, which is such a beautiful, beautiful place. I'm glad you're there, you're there. All right, so we are going to call all our panelists back. So we're gonna ask Chancellor Fidel to join us, Rio, Bryan, and Farah, and Kits to join us in the panel. But before we talk, before we have our panel discussion, we have our public service announcement from TVUP. TVUP, over to you.
O Apo, mukhang malalim niyang iniisip mo, ha? Wala ka mapasok ngayon?
Wala po. May disinfection kasi sa grocery.
Ah, ganun ba? Eh di ba wala rin kayong pasok kahapon? Pati nung isang araw?
Sana makabalik na ako sa trabaho.
O siya. Di na muna kita istorbohin at mukhang malalim yung iniisip mo.
Lo,
Ano?
magpabakuna na kaya tayo?
Walang problema, Apo. Paunahan mo lang ako eh. Talaga.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines, and it's headed by our UP Vice President for Public Affairs, Dr. Neni Pernia, and funded by the DOST-PCHRD and the Department of Health under the AHEAD HSPR project. Okay, Dr. Susie, did you want to have our questions answered muna?
Yeah, let's answer muna our demographic questions about the population.
Two questions. One for Sulu pala muna, and then another for Cebu. So this one for Dr. Fahra. Ma'am, what's the correct answer to what is the population of Sulu?
The closest would be 1 million.
1 million. That is letter C, which is, well, at least for Zoom po, no? 30% of our respondents selected letter C. And then for Dr. Bryan, what's the population of Cebu City, which is our second question?
Honestly, hindi ko alam, ha? Di ba? Nasa 1 to 1.5 ata eh. Medyo, sure.
Google na yan. Google na. Ano ba sagot dyan?
Okay. It says here almost 1 million, but that's 2015 data po eh. So
I think it's about 1 million for Cebu City, no? So I think really we wanted to have these little fun questions because you see these two places are the same, almost the same size, right? But you can see the difference in what should I say, in capacity, in support that's been given, despite a similar population base, no? So these are some of the things we have to address over the long haul kasi hindi talaga parang may disparity. How do we say that in Filipino? Hindi pantay-pantay ang ang kakayahan ng mga probinsya natin. Kaya importante talaga na meron tayong plano na lahat ng probinsya ay umangat. Hindi pa pwedeng lang yung mga malalaking syudad lang. Anyway, Raymond, do we have any question from our audience that we want to take up? Unfortunately, we're almost at the top of the hour. So, yeah, we need to take one question.
Most of our questions po kasi have already been answered by I'm trying to figure what's still there's one more open, and I think maybe Dr. Kits wants to answer this one. This comes from one of our avid followers, simula pa lang po, Dr. Joseph Tortona, and his question reads, could the reason behind the rise in cases in the provinces be due to people traveling back to the provinces, trying to escape the rising cases in NCR? And what was the role of, smuggling, quote-unquote, people trying to return to the provinces in one way or another via delivery trucks or etc.? Maybe Dr. Kits has an answer.
Siguro sa first part of the pandemic, we really had that problem where many of the residents, returning residents from Manila or from NCR, they were traveling by land, returning here in our city, and we had a lot of cases because of that exposure. Siguro sa first few months of the pandemic, siguro ganun. But now I think the rise of cases would be attributed to sa local na po. Sa local, we again, Iligan City is a gateway to Northern Mindanao. So marami pong nagta-travel. Merong mga OFWs, may mga from Luzon, Visayas, and even from Mindanao itself lang. So being a gateway actually would really be the culprit of the rise of cases here. Aside from that, siguro, poor public awareness, isa din, because a lot are still non-believers here. That's why we have a very low vaccination coverage. So regarding sa smuggling naman, I don't think it happens here, yung sa mga smuggling. So again, I would attribute the increase of cases here in Iligan City due to locally acquired na po.
Okay, thank you, Dr. Kits. Is that a fairly similar situation ba for Cebu, Bri?
Yeah, I think border control is always very tricky in an archipelago, no? So that's why here in Cebu we always say that we need to assume that it's already happening, no? May mga nakakalusot talaga. So I think the cornerstone really is community response. No? So kung maayos yung contact tracing, yung testing, yung isolation, kahit may makalusot, pwede po nating mahuli. But again, for our provinces who are listening, please take the Delta variant very seriously. No, I think learning namin sa Cebu, akala namin okay na, no? Sa second surge, bumaba, napaka-low ng mortality, akala namin okay na. But when the Delta variant came, it really tested the systems that were in place. So we continue to learn. So please do not take this lightly. No? Consider this as a warning. No? Ibang klase ang Delta variant.
Yeah, thank you, Brian. We'd like to go on and have more discussion, but it's the top of the hour. So we're going to give all our speakers a couple of seconds to compose your last few words, a very, very short message. You have nurses, doctors, health workers, hospital workers from all over the country who are watching you right now. And what's your parting message to them? But before that, we have an evaluation. So Raymond, let's put our evaluation up.
Okay, thank you so much. So we'll give a reprieve po, no? Just take a break para sa ating mga panelists to, let's say, just compose their final messages to our audience as we read po our assessment poll. Again, wala po tayong nire-release na evaluation link. This is the assessment for each of the webinars that we have been putting out. So we encourage our more than 1,300 or around thereabouts 1,300 attendees sa Zoom to participate in this evaluation. The questions read, number 1, the panelists demonstrated thorough knowledge of the topic. It's a Likert scale po, no? Strongly agree, disagree, and strongly disagree. So please just select your inputted answers po, no? Number 2, the panelists were well prepared and organized. Number 3, the panelist spoke clearly and audibly. Number 4, the panelist used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. We will not be closing ang ating evaluation poll. We hope that ang ating mga attendees who are still in the Zoom will be able to input their answers as we go back to our panelists. Dr. Susie?
Okay, let's go to our panelists now. And let's have our parting words from Dr. Fahra of Sulu. Fahra, go ahead.
Okay, first of all, I'm very grateful for this invitation. It was highly informative. Sabi nga, pareho lang kami ng population almost ng Cebu, pero parang opposite sides of the spectrum. Tapos listening to Dr. Lim, to Dr. Sino earlier?
Rio.
To all
Rio,
speakers, it
Magpantay.
was very informative. Pati yung sinabi ni Chancellor, parang dami mong matututunan. So maraming salamat. This is one way of really keeping in touch, even upgrading ourselves in terms of knowledge and information. So magandang platform, especially for us very far from Manila, na buti na lang talaga kahit nagpandemya, meron na rin social media. Ngayon, kung merong tinurong lesson dito ang pandemic na ito yung resilience, hindi lang ng health workers, ng mga tao, kung ano-anong naiisip para, to cope. Yung nga sa amin earlier na sinabi ko, yung mga beaches na hindi yan pinupuntahan dati. Walang pumupunta, hindi pinagkakakitaan. Privately owned, yung mga owners yan, private individuals. Pero ngayon, kasi hindi nakakalabas, hindi nakapunta ng Zamboanga, mahirap pumunta ng Zamboanga mga tao. Within Sulu, enjoy na kami. Parang mas peaceful pa nga ngayon. So, God has really, hindi natin talaga ma-question yung plan ng God. Sabayan lang natin yung ng alon. So maraming salamat to TVUPs. Thank you so much.
Thank you very much. That's Dr. Fahra Tan-Omar for those words of wisdom. Let's go to Quitos in Iligan City. Kits.
Thank you very much din po for giving me this opportunity to air out the frustrations of healthcare workers, frustrations of those who are in the provinces na masyadong fortunate to have the luxury of testing centers or the luxury of having great minds like Dr. Bryan Lim, Dr. Magpantay, Dr. Omar. I really hope that we have those sets of minds here sa amin. And it may appear that I'm just ranting, pero again, this is just me airing some frustrations and siguro pandemic fatigue, siguro, Sir Brian. Parang ganun yung Sir Brian, no? But no, these too shall pass. No, we're never stopping sa pag-pray namin na this will end, and so that we can see each other face to face, not in Zoom meetings na. Hopefully. So again, thank you very much. God bless everyone and please stay safe.
Thank you very much. Kits. Iligan City is very fortunate to have you there. So just hang in there. I know it's difficult, but thank you so much. Let's go to Brian from Cebu. Brian.
Thank you so much. I took up infectious diseases because I thought it's going to be benign. When I saw that, dati kasi pinili ko yun ang suspect sa IM. Ano ba yung pinaka-konting pasyente? Infectious disease tayo, chill lang to, chill, my quality of life. So nagsisi na kami ni kids na nag-infectious disease kami dalawa. But apparently, God placed us where we are for a reason. And in this pandemic, as a country, I see it as the growing pains of universal health care. I think I see this as an opportunity to rebuild and radically transform our healthcare system. I think never in our history is our society more aware and most aware of the importance of the health system than it is now. And I think I'm looking forward that we as a in our society will be able to realize this. And I've learned some 5 lessons. First is we are all interdependent. No? Walang kanya-kanya, walang nabubuhay na mag-isa. And medicine is really truly more of a social science than it is a clinical medicine. No? And health is really beyond the DOH. No? Hindi dapat inaasa lahat sa DOH. Kawawa ang DOH kung lahat ng problema ibibigay natin doon. So many solutions can be done when we link up different sectors. And that's what I have seen firsthand. And humility is key. Ilang beses na rin po akong pinagalitan, sinigawan, pero lunok lang ng lunok. No? Kasi po, even if our recommendations may not be accepted at a particular time, hindi tayo dapat nagagalit. Ako, push lang ng push, tutulong pa rin kasi I always see that there is always an opportunity to serve, no? Even with people that we disagree with, no? Communication, I think, community response, no? And I would like to borrow Dr. Cordero that we need to really deviate from the hospital-centric. I'm a hospital person, I'm a clinician, but I have seen if you focus on the community level, if you pour money to the barangay captains, you support the contact tracers, you make even the chismosas in the barangay, gamitin mo, have them on board. For me, that's a more lasting solution than focusing so much on hospital care. No? And I think long-term, we should start planning for long-term resiliency. And I encourage all the listeners, please form them now. Hindi po excuse na ngayon we are struggling with Delta, na hindi na natin iniisip kung ano yung long-term resiliency plan ng ating mga probinsya. So totoo lang, tayo-tayo lang din ang magtutulungan. Salamat po.
Thank you very much, Brian Lim. Thank you so much for those inspiring words. Dr. Rio Magpantay. Rio.
Pasensya na po, talagang dapat paigtingin ang Wi-Fi connection dito sa amin. Gusto ko pong gamitin, Dr. Susi, yung PDIPR. Pero Tagalog po ang ilalagay kong kahulugan nito. Prevent, detect, isolate, treat, and reintegrate. For P, dapat paigtingin ang disiplina at itaguyod ang tama at responsableng aksyon laban sa pandemya. Sino ang dapat paigtingin ng disiplina mula sa baba hanggang sa taas? Everyone knows. Hindi naman lahat po ng tao ay disciplined to do what is right. Everyone knows, alam natin kung ano ang dapat nating paigtingin pa tungkol sa disiplina. Mula po sa mga mamamayan na nasa loob ng kanilang bahay hanggang sa mga nagtataguyod. Ang ating mga local government units, ang ating local chief executives, ang mga politiko, ang mga namumuno hindi lang sa kagawaran ng kalusugan kundi sa lahat po ng mga ahensya. Dapat sama-sama po tayo may disiplina. Itaguyod ang tama at responsableng aksyon. Ano ba yung tama? Ano ba yung responsable? Marami po tayong eksperto. Marami po tayong mga linya ng mga magagaling na talaga po namang binibigay ang sarili nila para maitama po ang mali at para maging responsable po tayong lahat. Kung lahat po yan ay intindihin, lahat ng mga nakakaintindi at lahat ng hindi pa nakakaintindi, then we'll have a better nation. Hindi ho mag-e-end ang pandemya bukas. Hindi rin po sa makalwa. Hindi po natin alam kung kailan. At kung hindi po tayo kikilos bilang isang nasyon, wala hong mangyayari sa ating lahat ng mga aksyon. Marami pong salamat sa oportunidad at ako po'y natutuwa at nakasama kong lahat po kayo, mga speakers natin. Kahit po sa virtual, sana ay lagi rin tayong mag-meet. At eventually soon when this ends, pero hindi po soon ito, I am sure of that. Tayo rin po ay makikita buhay, masaya, at higit sa lahat, nakapagpasalamat na tayo po ay nakapaglingkod ng maayos. Isa pong magandang hapon sa ating pong lahat.
Yeah, thank you very much, Rio, for those heartfelt words. Let's go to Chancellor Fidel Nemenzo. Chancey?
Sir, you're on mute. Ayan, okay, sir. Go ahead, sir.
Wala akong masabi kundi saludo ako sa inyo, Docs Fahra, Kids, Bryan at Rio. No? What steep learning curves you've gone through, and I really admire the work you've been doing in your communities. No? Malaki ang pasasalamat ng buong bayan sa mga frontline na kagaya niyo. At sa audience, sana kagaya ko, marami din kayong natutunan at sana ibahagi ninyo ang inyong bagong kaalaman sa iba. Maraming salamat, Doc Susie and Doc Raymond. Magandang hapon sa lahat.
Thank you very much. That's UP Diliman Chancellor, Dr. Fidel Nemenzo. Okay, so our closing remarks will be done by our very inspiring Chancellor of UP Manila, who is able to bring together all these details into a rapid conclusion. So may I call on Chancellor of UP Manila, Menchit Carmencita Padilla. Menchit, please take the floor.
Thank you, Doc Susie. Our webinar today was opened by Dr. Fidel Nemenzo, Chancellor of UP Diliman. And he started the session with reminding us that there are reasons to be thankful, and we are given the opportunity to share experiences as we document our struggles and use these as grounds for sharpening our lessons. In UP Diliman, they demonstrated UP resilience. Though not a health campus, they participated actively in the COVID pandemic. Early on, he set up the multidimensional COVID task force to respond to the needs of its faculty, students, and staff, as well as the residents within Diliman. Here are the realizations of Chancellor Fidel. One, we need a community-based response, very similar to what our doctors shared with us. Number two, there is a need to capacitate the university on pandemic response. And three, with 100 buildings, there is a need to set up monitoring teams using measures that are compliant with DOH and IATF. UP Diliman did its share. They have set up quarantine facilities at Palma Hall, Cambia, and Malave. They have a vaccination site. And they also appreciated the value of collaboration with LGUs, NGOs, and individual volunteers. So the university can have a very active role in the whole picture, and I think UP Diliman has been able to demonstrate that. And he ends by saying that it's not just the COVID, it's not just the COVID pandemic. We have the pandemic of misinformation, and he said that agham ay makakatulong. Now all our panelists had the very interesting sharing, and I will not be able to capture all of them. And I encourage you to actually watch the replay. And what I will do today is maybe group them. For the first two speakers, Dr. Rio and Dr. Bryan, allow me just to share the innovations that I have put in. I mean, all of them gave the statistics, the scenario, the challenges in their own provinces or cities. But in the interest of time, allow me just to concentrate on these points. In Cagayan, they had the flying vaccination teams, Res Bakuna on wheels, complementing the PRC Bakuna bus. They had the Res Bakuna jingle, the TikTok challenge, and Res Bakuna pantry. They had the one-line command center and several hashtags, hashtag Ugnayan, hashtag Unawa, hashtag Mitsa, and hashtag networking. At the end of the day, Dr. Ria said that, we have to get up together and we have to recover as one. In Cebu, Dr. Bryan gave the hard lessons in Cebu. And allow me just to concentrate now on the innovations. He starts off by saying that there's a need for synergy, clarity, and collaboration of the private sector, the LGUs, and the national agencies. There are times you don't need a doctor. You need somebody down there in the community to put us all together. But some of the interesting innovations in Cebu will be the Emergency Operations Center Manual, a step-by-step cookbook on how to set up the emergency protocols, the unified protocols, algorithms, and so on. Number two is the Bayanihan Cebu, a modified isolation facility with a triage system, guaranteeing admission to a tertiary hospital when needed. And of course, with an ayuda if you're part of the system. Number three is Balik Buhay, the Chamber of Commerce, the panghakot by industry, wherein by registration, they're able to form a certain form of herd immunity in that particular industry. I like this. PBB Salbabida program, an additional 15,000 to the healthcare workers, showing solidarity with the private sector. And the last one is Telegabay. Now, our last two speakers, Dr. Quitos and Dr. Fahra, gave us the situation in Mindanao. And I'm sure that all of us appreciate their struggle, being very far from the metro cities. We heard their frustrations, the lack of testing, resources, the manpower, the overtired, nurses and doctors in the hospitals and in the RHUs, the lack of ventilators, the glaring need for testing, the need for more COVID beds, so many life-saving equipment that must be available even in the farthest island of the Philippines. But we thank them. We thank them for staying in their provinces because we need people like you to stay put in your own places so that we can continue to serve the rest of the Filipino people. With the 4 presentations, we appreciated the vast differences across the country despite the same population in terms of level of testing, level of vaccination, availability of resources from beds to ventilators. But one thing is also clear in all of our presentations, we appreciated the value of collaboration among the various sectors, both private and public. So indeed, it is a whole of society and a whole of government approach that will help us combat the COVID-19 pandemic. But as Dr. Rio Magpantay said, we never lose hope. Magandang hapon po sa inyong lahat and back to you, Doc Susie.
Thank you very much. That's UP Manila Chancellor Menchit Padilla. I think, am I on?
Yes, you are, Dr. Susie. Yes, you are.
Okay. So that's our Chancellor Menchit Padilla. Thank you so much for that, Menchit, putting together all of those different pieces into a singular message. Maraming salamat. Okay, next week. Very exciting topic. Don't miss it. Next Friday, we will talk about booster shots. Ano ba yung booster? Ano nga ba yun? Okay? So we're going to talk about that. Don't miss it. Invite people to join us. We're going to bring you some experts who will talk about what we know at this point in time. So there's still a lot that we don't know about what we call booster shots, but we will try to understand that. So I also mentioned earlier, if you have watch parties, please put up your photos on Facebook and we will show them on the webinar. Okay, over to you, Raymond.
Thank you for that excellent roundup and closing remarks, Dr. Padilla, our Chancellor. And we are also seeing on the screen the results of the assessment poll. Obviously, very, very consistent with what our previous webinars have had, although slightly higher, just because at least 92% of the respondents. Wala po tayong strongly disagree or disagree this time, Dr. Susie. So that's a good sign. Maraming salamat po sa lahat po ng respondents. 944.
Wow.
So I think that will be representative at least po of those who were in the Zoom webinar kasi 82% po ang participate for our Zoom poll. Before we conclude our program, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series po. Without each and every one of you, this learning series and our credible online community will not be created and will not be possible. Finally, all of the 69 episodes, the Stop COVID Deaths webinar series, including this episode right after this one, will be archived in the YouTube channel of TVUP. So yan po, makikita nyo po lahat ng ating mga webinars po na nandun lang po sila sa YouTube channel. So you'd be able to play them again and learn from each and every webinar again. So as mentioned, makita-kita po tayo ulit next week. Same time from 12 noon to 2 p.m. every Friday. We hope that our credible online community continues to grow. And we look forward to your company again next Friday. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others faint before my fears. The others laugh before my tears. But right behind the mask, I look into myself and ask, Do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears, but right behind the mask I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others loves before my tears, but right behind the mask I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will